yes, the preventive system do exist and it is being done. NCD clinics are being run in a health checkup hospital. And NCD is not communicable diseases. For example, they look for BP, sugar, diabetes, BP, diabetes, cholesterol, then cancers, etc. in the NCD clinic. Hello everyone, I am Dr. Ashwati Soman. Yes, our system do support preventive care. That is why, see, when you go to a doctor and he know that you haven't done any test for the past few years, he'll naturally ask you to do such and such a test. That is because one thing, it might be pertaining to the symptoms with which you presented to the doctor. That is why he asked you to do those tests. The second thing is that according to the age group and your family history and other factors on the physical examination findings, he might think you need some test and he might be suggesting you. For example, if you are very fat, if your BMI is very high, with one look the doctor can understand that your BMI is very high, and then definitely naturally he'll be asking you to do a BP checkup or a lipid profile or a diabetic test. Maybe you are very younger age, but still then he might be asking you to do such tests just to know if you are healthy. So yes, our system do support preventive care. Not only that, we are having a lot of days. For example, we have breast cancer awareness week, we have TB awareness week, you have leprosy awareness weeks, like that you have a lot of diseases awareness weeks and lot of health days that is being celebrated all over Kerala in the private and government setup both. So that is actually giving you information regarding these diseases that is being present in our population. So, and you are being given awareness of that disease that is in the population, so that if you are having some symptoms related to these diseases, you can go to get tested and you can find out in an early stage. So you have to, that normally all the diseases that is going to affect and do have these important health days. So every health day, every important health day, it is actually giving you awareness about that particular disease. That is one sort of preventive care that is happening in the system. And along with that, for some random test samplings used to be done. For example, then in a population, they might take a random cough sample, sputum sample, they might take a random sputum sample to test for TB. So in that, in some cases, if there is a disease that is happening around all around, for example, in case of COVID, there was a normal public, even the normal public were tested to see whether the COVID has spread to such a great extent, or what is the percentage of COVID that is happening in your population, etc. So yes, the preventive system do exist and it is being done. NCD clinics are being run in a health checkup hospital. And NCD is not communicable diseases. For example, they look for BP, sugar, diabetes, BP, diabetes, cholesterol, then cancers, etc. in the NCD clinic, which is not communicable. Communicable disease is a group of diseases that can be, communicated from one person to other. That is, if you have a disease, the other person can get that disease from you. That is a communicable disease. Non-communicable diseases like diabetes, hypertension, hypercholesterolemia, etc. These are not communicable diseases, but because that is happening to you and you have that disease, and then another person is not going to get the disease from you. So such clinics do exist for a preventive measure in our setup.